Project to empower students. Mental health initiative. Background health is an important determinant for social and human capital, in which mental health is an integral construct. It is also a fact that there is no health without mental health. Mental health are not merely important for the lives of children and adolescents, but it's pivotal for building their career, character and capacity. It is responsible for their overall well-being, healthy emotional, social, physical, and educational development. Problems arising out of mental health have a serious impact on children and adolescents. For example, these students are twice as likely to report feeling very stressed and 3 times more likely to have poor physical health. They are likely to perform below grade level, use alcohol and other drugs, and think about killing themselves. 20% of all children and adolescents are affected by mental health problems. Such children remain untreated and suffer stigma, discrimination and deprivation. There is now increasing evidence that effective interventions can improve children's and adolescents' resilience, promote mental health and treat mental health problems and disorders. An organization which is involved in providing education to underprivileged children, I believe, must address their needs in a comprehensive manner. There are 2 main challenges in providing comprehensive education which involves mental health promotion. 1. Identification of adolescents who are at risk. 2. Providing health-related intervention to build skills for developing career and character. Why bring mental health to schools? Education empowers people, provides strength and self-confidence. When our children are educated, healthy, and happy and have access to opportunities, they are the country's greatest human resource. Schools are places where the students come together and spend most of their time with peers and teachers. There is scientific evidence that if developed and implemented well, school mental health services can ensure equal opportunity to develop to the fullest of their capabilities, cognitive, social, and emotional. It can improve the chances of overall physical as well as mental health, increase the comfort of family members, minimize the problems related to transportation, accessibility, affordability, and stigma. School settings provide additional opportunities to observe children and intervene directly in the school setting. Education-based mental health program can facilitate path-breaking changes by addressing their specific needs, for example promoting health and well-being, identification and early intervention for mental health issues, physical health, specific disabilities, and complex health need. How IT can be done. Setting up research-based services. We need to develop and implement innovative and effective mental health initiatives. The program needs to be available to all children, be simple in methodology, feasible and practical in implementation, effective, accessible and affordable. It will be then economical in developing the human resource. Such programs using modern internet-based and computer-generated educational curriculums are feasible and effective. School-based care in distant areas is possible by training of the teachers using web-based education. We need to incorporate yoga, health awareness, management and planning, self-care, social responsibility, character building, career development. This will require 1. A training curriculum for teachers. 2. An educational curriculum for students. And 3. Dedicated time allocation for both. A proper implementation will require that the program becomes an integral part of teaching and learning process. Funding will be required for 1. Providing laptops or tables to the students and teachers. 2. Developing the computer-based audio-visual courses in local languages. 3. Implementation of program. 4. Research and program evaluation. It can be developed and implemented in a phase-wise manner. A preliminary pilot project may be done prior to rolling out the full program. I am enclosing a web-based training module for your reference which has been developed for training in mental health and suicide prevention. We strive to make the children best people for empowered and effective citizens. Enclosures. 1. Links to https://www.youtube.com/watchquest.
Suicide is a major preventable cause of premature death. influenced by psychosocial, cultural, and environmental risk factors. Suicide behavior cannot be predicted with certainty.
One of the main barriers for suicide prevention is stigma. Families do not talk about suicide. It is seen as shame and sin. They hide it. The stigma thus perpetuates suicidal thought and leads to further attempts of suicide. We must realize that stigma is a clinical risk and needs to be dealt with clinical measures. In one of our studies conducted in Mumbai, 300 patients asked about measures for reducing stigma. It was heartening to see that a large number of patients believed that stigma can be reduced. More than 80% of patients feel that the best way to reduce stigma is to provide treatment.
I lost my son.
I lost my husband.
पति मर गया, बर्दाश्त न कर पाई।
Every 40 seconds, someone in the world kills himself. In India, one person every 4 minutes dies because of it. It is one of the leading causes of premature death in the world, claiming the life of approximately 1 million individuals every year.
Every suicide affects at least four other members, and their risk of suicide attempt increases in return. In our country, more than 130,000 people have killed themselves in 2011. 1 in 60 people in India are affected by suicide.
Families do not talk about suicide. It is seen as shame and sin. They hide it. More than 80% of patients feel that the best way to reduce stigma is to provide treatment.
Our project is education and training for suicide prevention. Patients remain untreated and suffer detrimental consequences of suicidal behavior as well as of underlying mental illnesses. Lack of training leads to lack of appropriate services and poor awareness. Therefore, training and education, especially for people like teachers and health workers who are in direct contact with vulnerable groups, can help increase identification of individuals with related problems. They can then offer support and make a referral. Purpose of this project is to develop manpower that can aid suicide prevention in different regions globally. As the treatment of suicide behavior becomes more visible, more services are likely to be established. In this project, we propose to provide web-based resources for education applicable to individuals and organizations both. Identification of individuals who are likely to attempt suicide is extremely difficult and appears almost impossible. A detailed description of methods and measures to identify suicide and depression are covered here. These include asking key questions about suicide directly, use of screening tools, and carrying out a detailed interview. When to ask these questions?
Though many exist, one of the most common scales for identification is the Beck Suicide Ideation Scale. Prime MD is another suicide identification scale. The questions which can also detect depression are: in this, the first three questions show possibility of presence of depression.
Reading and practicing the techniques described here is likely to facilitate identification of suicidal patients amongst those who are attending primary care clinics.
It's possible for doctors to recognize the warning signs, but all need training. We need to train them.
Depression is a disorder which can be prevented. It can be prevented by providing very early intervention due to treatment and counseling. And it can also be prevented by remaining vigilant that during growth and development of children and adolescents, enough is being done to make them robust psychologically and physically so that they are able to deal with adversities in their life. While talking about mental disorders, I will try to explain it as to what factors are responsible for its development. So, to begin with, there are factors which are involved in generation or development of mental disorder. There are some factors which contribute to its severity and persistence. This could be psychological or social. And there are third group of factors which allow it to persist through the life course. A trajectory or pathway how mental disorders develop and what are the social, biological, brain factors and psychological factors which contribute. In order to prevent these development of mental disorder, it's important to focus on these factors. For example, on the childhood development and preventing children from adverse psychological and social stress is most important. Now, there are inherent capacity in the human being to protect against trauma, and out of these I would mention three or four. One is the social support, the second is the personal resiliency, the ability to cope and adapt, and the fourth is the determination and seeking treatment to maintain the recovery.